Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and question analysis sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, I always like to go over my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. All right. The things that are up and coming, my practice question course is next week. We're 1 week, exactly 1 week away from class, 10:30 to 11:30. For those of you who have signed up, I am excited to work with you, and know that you will receive the access links this week for it, as well as after the class, you will receive the practice questions as well as test taking tips. So I look forward to working with you guys and seeing you then. And then also, if you guys for the antibiotic and diabetes worksheets, they are linked in the description of this video. So if you're looking to get any of those to help with your studying or even in practice, click the link and grab yours. All right. Question number one for today. A 35-year-old patient presents with a history of coughing, wheezing, and chest tightness, particularly at night. Which condition should be considered in the differential diagnosis according to the GINA guidelines? Select the best three. Is it A, COPD, B, pulmonary hypertension, C, GERD, or D, sinusitis? Take a moment and tell me what you got. All right, all right, all right. So, stem of the question, I always recommend reading the stem of the question first, as it allows you to slow down to ensure that you're answering what's being asked of you. So, the stem of the question here states which condition should be considered in the differential diagnosis according to the GINA guidelines. Select the best three. Now, y'all know, and I put this on here because I try to prepare you for how testing questions may present. ANCC does select the best two, select the best three. Now, I do always say that I think that's better than what we know from NCLEX of select all that apply, because when you tell me to select the best two or select the best three, I can at least narrow it down to know that you're looking for this amount of answer choices, right? Instead of second guessing yourself, like, could it potentially be one more or whatever. I think select the best two and select the best three help. But my other recommendation is make sure you are highlighting these or paying attention to these. This is why the stem of the question is important. This is just like if it says not in the stem of the question, making sure you know this so that you don't go and just select one answer and get it wrong because you forgot that it was looking for three answer choices. Okay. But all right, so it's asking for the differential diagnosis. So this person came in and they are 35 years old, presenting with a history of coughing, wheezing, and chest tightness, more commonly at night. They're noticing it more at night, right? So the best three would be A, B, and C, right? COPD, pulmonary hypertension, and GERD. Sinusitis, they may have pressure from the inflammation to their sinus areas, but wheezing, chest tightness is not presentations typically associated with sinusitis. Question number two. Which of the following should be included in patient education to help manage asthma according to the GINA guidelines? Is it A, avoiding all physical activity, B, identifying and avoiding known triggers, C, using inhalers only during acute symptoms, or D, discontinuing medication if feeling well? Take a moment and tell me what you got. All right, so here the STEM is the question. The question is the STEM. So, which of the following should be included in patient education to help manage asthma according to the GINA guidelines? And the best answer is B. You want them to be able to identify their triggers, number one, so that they can avoid those triggers, right? A, we know we're not avoiding all physical activity. Remember that we talked about this a few days ago on one of the questions. Asthma with physical activities, you can utilize an inhaler 15 minutes before any activities to help decrease the chances of exacerbation. So you don't have to avoid all activities. So A is not true. Using inhalers only during acute symptoms, that's not true, because what if they're on a maintenance regimen? So we're not teaching that. And then we know we're not saying discontinuing it if it's if they're feeling well. No. So B is your best answer. And then lastly, question number 3. A patient with asthma, step 2, is currently on a low dose ICS plus a LABA and reports that they are experiencing nighttime symptoms at least twice a week. What is the most appropriate next step in the management according to GINA guidelines? A, increase to a high dose ICS. B, add a LABA to the current treatment. C, increase to a low dose ICS plus a LABA daily. Or D, maintain the current treatment and schedule a follow-up. Take a moment to tell me what you got. All right, so stem of the question here states, what is the most appropriate next step in the management according to GINA guidelines, right? So what is the most appropriate next step in management according to GINA guidelines? So what are we managing? What are we managing? This is still a treatment style question. And I tell y'all, if they're asking for a treatment, you need to run it back and see if they have provided you with a diagnosis. If they have not, then you run it back a step further and look to see what the assessment findings are. So here they actually have given us a diagnosis. This patient has asthma and they're in the step 2 of the asthma stepwise approach, right? They're currently on a low dose ICS plus a LABA, and they report that they're still having nighttime awakenings at least twice a week. So we know that warrants stepping up the stepwise approach. So you want to move up to C, increase to a low dose ICS plus a LABA every day. Okay, because in step 1 and step 2, remember, they're on the low dose ICS PRN, ICS and LABA combination PRN. And then when we go up to step 3, we increase to that same combo inhaler daily. Step 4, now we increase the dose. We bump up from low dose to medium dose, then from medium dose to high dose. Then from high dose, you can also add in a LAMA. And that's how we go up our stepwise. So C is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. If you still need some breakdown of the GINA stepwise approach and when to treat, how to treat based off of the preferred controller, the preferred reliever, I have added that in the description from the video that I created the other day for you guys to help you along with that studying, okay? But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. The things that I do offer are my review book. You can get an ebook or paperback option. They're both linked in the bio of this channel. If you prefer to study independently, my self-paced review course is linked in the bio of this channel as well. It's designed for family and adult general reviewers preparing for both the ANCC as well as AAMP. If you need to do any practice questions, my QBank options are linked in the bio of this channel. And if you're looking to book any of my one-on-one sessions to include exam readiness assessments, question analysis sessions, or any of the structured custom plans in one-on-one sessions, I always say give us a call, shoot us a text, or shoot us an email, because I prefer to gauge what you truly need before you book a session so that we can make sure which one of those sessions are going to meet the needs of your goals of what you need to do to be successful on boards. Okay, so if you're looking for any of those one-on-one options, make sure you reach out from any of those contact options. Okay, but y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.